what is erectile dysfunction and how common it is, I'll just tell you that erectile dysfunction can stem from a range of causes. ये जो cause हैं, they are different in different age groups. It is surprising that erectile dysfunction affects around 50% of men over the age of 40, and it is even more common as men grow older. More importantly, high blood pressure, alcohol consumption, using illicit substances, and the most notorious is smoking. Assalamu alaikum Nazreen. This is Professor Dr. Raheel Karim. I'm going to start a series of videos on sexual health, and part of that, I think today we will be talking about erectile dysfunction. So what is erectile dysfunction and how common it is, I'll just tell you that. So erectile dysfunction can stem from a range of causes, यानी कि इसके कई causes हो सकते हैं, और ये जो cause हैं, they are different in different age groups. For example, people in their 50s, causes are usually related to physical health like diabetes, high cholesterol, depression, more importantly high blood pressure, alcohol consumption, using illicit substances, and the most notorious is smoking. And there's an expert, Dr. Newton. He says that it is surprising that erectile dysfunction affects around 50% of men over the age of 40, and it is even more common as men grow older. Other than that, many men are hesitant to bring it up, their difficulties regarding erection with their doctors. Aging by far is the most common cause, with a wide range of psychological, neurological, vascular, hormonal, and medication causes that can contribute to erectile dysfunction. Roughly in about 80% of the people, a physical cause can really trigger erectile dysfunction, and the most common that we see in our clinical practice is chronic high blood pressure or hypertension. The second biggest killer of erectile functioning is smoking. It is the enemy of erectile dysfunction, and many studies have shown that quitting smoking can bring back some of the erectile function. So causes and physiological factors are amongst the most common contributors. Psychological causes, if I was to focus on them, often involve the mind's influence on sexual function and may be deeply intertwined with emotional, mental, and interpersonal elements. So here is an overview of the key psychological causes of erectile dysfunction. So you first have to understand how the psychological causes can actually affect the functioning of the erection. So, a robust connection between the mind and body is very important, and this leads to improved sexual functioning and performance. When the connection between the mind and body is deficient, or it is affected by other things, erectile functioning definitely then gets impaired. Most commonly, what is seen as a psychological cause is what is known as performance anxiety. I've touched upon this in my other video, but what is performance anxiety? This really is a fear or nervousness about one's ability to perform sexually. So what then happens is that if you are not able to perform very well on one occasion and the erection isn't that firm, it can lead to a cycle of worry that worsens over time, as anxiety can then interfere with arousal, leading to difficulties in achieving or maintaining an erection. So there is a very deep connection between anxiety and arousal, and this anxiety and arousal, the curve is known as a parabola curve. The more anxious you become, the reduce the performance, whether that is performance in sports or whether that is performance during a sexual activity. Another thing that really affects the erectile functioning is the stress. The stress about potential failure often makes the problem worse. because anxiety can inhibit body's natural sexual responses. ये फिर क्या होता है कि it creates a negative feedback loop where the fear of failure actually increases the likelihood of erectile dysfunction. We all lead a very stressful life, and the stress is far more in terms of what I see in England, but clearly here there are daily stresses in Pakistan. So stress from work, stress from family, stress from extended family, financial concerns, or other life pressures can really take a significant toll on sexual health. So whilst there can be acute stresses, but what I see in my clinical practice is that chronic stress is really a killer of erectile functioning. So what happens during chronic stress is that there is usually an overproduction of a hormone जिसको हम fight and flight का hormone कहते हैं, which is known as cortisol. So cortisol is produced by a gland that is on top of the kidney, and it produces a hormone that can interfere with sexual functioning. There are a lot of studies in this regard, but according to a study done in 2022, chronic stress reduces the blood flow to the penis, which then reduces the firmness or the duration of erection. So reduction in blood flow may be due to changes in the nerve signaling in various pathways relating to the erectile response. It is very important, therefore, to learn to manage and relieve stress, as it may help with a better erection. Stress, on the other hand, can also decrease libido or the desire to have sex or to be able to focus on the sexual activity, making it harder for the individuals to relax and engage in sexual activity. When stress persists, or if it is chronic, it may impact overall mental health, including self-esteem and body image. Other important psychological factor that can affect sexual functioning is depression. I'm not talking about ordinary unhappiness. Depression is a mental health disorder characterized by persistent sadness that extends over more than 2 weeks, with loss of interest in activities and a lack of energy or motivation. Lots of people say that erection is a good index of the desire, and depression can result in a lack of interest in sex and reduced desire. It can also lead to feelings of inadequacy. आप कमतर महसूस करते हैं अपने बारे में, which can then affect erectile function. Medication, some of the physical health medication as well as the psychiatric medication, especially SSRIs, मैं उनके नाम आपको नहीं बताऊंगा इस वक्त, may have side effects that interfere with sexual performance. However, because of these things, there are many new antidepressant medications that have come out in the market which actually do not affect sexual functioning. Sex is an index of the quality of the relationships that people share. Problems in a romantic relationship, whether due to poor communication or persistent unresolved conflicts, and certainly infidelity or a lack of emotional intimacy, can have a direct impact on sexual health. So relationship issues lead to then emotional distancing, उसमें resentment आ जाती है, feelings of insecurity आती हैं, and all these things can then diminish sexual desire and ultimately impair performance. In clinical practice, what I see is the lack of trust or frequent arguments between couples can make intimacy feel less satisfying or enjoyable, leading to performance anxiety as well as avoidance of sex. There is recently a lot of focus on body image and self-esteem. So these are clearly very integrally important issues. So if you have a negative self-perception regarding your own appearance or abilities, this can significantly affect your sexual performance. Men who have body image disturbances, or they don't feel confident about themselves or have lower self-esteem, possibly worry more about their sexual functioning. They feel that they are not able to correspond or attend to societal or personal standards, and this then leads to difficulty and anxiety, and difficulty especially in terms of becoming aroused. This is especially common in men who feel that they are not masculine enough or fear judgment from their partners. So sometimes when you have negative comments from your partner, this really then leads to low self-esteem, and the individual or the man feels that he's not man enough to be able to satisfy their partner. Commonly practice mein you see that sexual trauma or abuse, especially in childhood or when in their teens, a history of sexual trauma, including abuse or sexual assault, can deeply affect an individual's relationship with sex in adulthood. So what this trauma does is that it leaves psychological scars which can make an individual difficult to feel safe or relax during sexual activity, leading to erectile dysfunction. This may also manifest in other forms of sexual dysfunction, and it can lead to lack of desire or avoidance of sexual situations. Very importantly, guilt or shame around sex. So, all cultures have different parameters of how sex should be and how sex should be done, or how accepted it is to have sexual relationships. So cultural, religious or personal beliefs can lead to feelings of guilt or shame regarding sexual desire or behaviors. So one must understand that sex is a gift from God, and it is very important for the purposes of procreation, and that is why God has instilled these desires in us to be able to. But the culture and society sometimes has conflicting views, or it is generally seen that people should not be talking about sex, and it is sometimes we are taught as children that sex is not such a good thing to talk about. So there is a certain element of shame that is related to sexual activity. So all these cultural beliefs and religious beliefs can create emotional barriers to a healthy sexual functioning. Eventually क्या होता है कि this can manifest as performance anxiety, sexual avoidance, or lack of arousal, all of which then further contribute to one's ability to have an erection. एक जो मैं culturally पाकिस्तान में बहुत देखता हूँ और possibly elsewhere in the world is the expectations and the unrealistic beliefs that people have about sexual performance. Lots of people I see in my clinics who are guided by ill-informed people as to what sex should be like and how sex should be performed. So sexual performance, whether from a cultural perspective or watching pornographic material, or from the society or peers. So it is commonly seen that peers या आपके जो दोस्त हैं, they brag and they present an exaggerated view about sexual performance, which can then create stress in people who maybe are not that sexually experienced. So they then have a constant pressure to perform or to live up to the exaggerated standards, which can interfere with a person's ability to relax and enjoy sexual activity. This then leads to a disconnection between the brain and the penis, leading to anxiety and erectile difficulties. Individuals who have obsessive compulsive disorder or they have obsessive thoughts, I'm talking more about a mental health condition, then can lead to anxiety disorders or generalized anxiety, which can then affect the individual's sexual health. What really happens is then whilst individual is having sex, they have preoccupying thoughts in their mind which are persistent and intrusive thoughts. So these thoughts then interfere with the signaling from the brain to the penis and can make it difficult for a person to focus on the present moment of the sexual activity, leading to a disconnection between mind and body. So constant worry and fear of sexual failure is one of the most important and integral part that can inhibit arousal and erection. We'll talk about something known as a cognitive distortion. So cognitive distortion basically क्या होती है? These are irrational thoughts or beliefs that can influence how a person perceives their sexual experiences. What is their idea of an adequate sexual function? So for example, if a man has a tendency to catastrophize, which essentially means that they're expecting the worst outcome, he may assume that a single instance where he has failed to have an adequate erection means that it could be a permanent loss of sexual functioning. So this then leads to further anxiety and further sexual dysfunction. These negative thought patterns then can perpetuate or maintain erectile difficulties. We now talk about psychological causes that can interact with physical causes. It is important to note that psychological causes of erectile dysfunction do not exist in isolation, and they often interact with physical health problems. For instance, physical health issues like diabetes, hypertension, or hormone imbalances can trigger psychological responses. People feel less confident when they are physically unwell. This can then lead to anxiety or depression, which can then exacerbate erectile dysfunction. In turn, ongoing erectile dysfunction can then become a stressful state in its own right and cause strain in relationships, further compounding the psychological aspects. So treatment approaches have to address the psychological causes of erectile dysfunction, which is often an involvement of combination of therapy and lifestyle changes, cognitive behavioral therapy, sex therapy, and counseling can certainly help address the emotional or psychological issues. It is important to have treatment to reduce your anxiety. Most importantly, I feel that sexual communication is very poor between partners. So, especially in our culture, it is a taboo to talk about sex, and people generally believe कि अगर हम sex के बारे में बात करेंगे आपस में, even married couples, so it's not the good thing. A woman should not be expressing her views about sex, as this is not seen as something very acceptable from a cultural perspective, as we have been told these things right from the early. Moms tell their children, or especially women, as to how to behave sexually and how to conduct themselves, which may totally in this day and age be far from the truth. Masters and Johnsons are very famous people. They are sex therapists. They actually work with couples and they can work wonders. And remember, sexual dysfunction or dissatisfaction is a problem between two people. So the treatment has to be geared up towards the couple. Other than what I've told you, practicing relaxation techniques, meditation, breathing exercises, and progressive muscular relaxation is certainly I can recommend, which will reduce your stress and anxiety, making it far more easier for you to relax and focus during sex. So couple therapy is very important. So it has to be, it's a professional problem. So it has to be dealt with in a professional way to address communication, resolve conflicts, and basically, more importantly, is to rebuild intimacy. This is the end of this bit. So what can you do to improve your sexual functioning? So I will be telling you a lot about general things, but also a balanced diet. So exercise, a balanced diet, most importantly adequate sleep. So अगर आप नींद नहीं पूरी करेंगे अपनी, तो आप all round functioning impair हो जाती है. If you are stressed or if you're a habitual alcohol or drug user, this certainly needs to be addressed as an issue. Very important is that if you reduce weight, this can help to contribute to better mental and physical health and is definitely going to reduce the psychological impact on sexual function. So really, any physical activity that improves your cardiovascular fitness or fitness of your heart is likely to have a positive impact on erectile functioning. So what I would certainly recommend is 45 minutes of exercise 3 times per week, perhaps jogging, even a brisk walk, swimming, cycling definitely helps. There are some other recommendations from my cardiologist friends who say that if you exercise or even just walk for 30 minutes, essentially 5 times a week, walking is by far the best exercise. Extremely important to understand that alcohol is a killer of sexual joy, and so is smoking. So do your best to seek help regarding both these areas, which can be really problematic with sexual functioning. Lots of people do not understand that staying hydrated can reduce blood volume and affect blood flow throughout the body, including affecting the blood flow to the penis. So what happens is that the blood volume reduces when we are less hydrated, so consequently there is less blood to flow into the penis, and therefore it can then affect the sexual functioning. Other natural remedies or diet, as I've talked about earlier on, जो चीज़ें हैं ना जो which are folate rich food products, they definitely help. And there's a lot of scientific evidence that if you took like beef liver, or if you used greens such as spinach or saag, Brussels sprouts तो पाकिस्तान में पता नहीं मिलते हैं या नहीं मिलते हैं. Broccoli is another very good vegetable to have. Avocado, asparagus, eggs, citrus fruits, bananas, beans, peas and lentils, and other legumes, cereals, including pastas, are also rich in folates. The Chinese swear by it that red ginseng is a herb used in traditional remedies, also known as the herbal Viagra. There is also work to suggest that watermelon juice leads to increased production of a chemical जिसको हम nitrous oxide कहते हैं. जब nitrous oxide blood में जाती है तो it improves and relaxes the smooth muscles of the blood vessels. Therefore इससे ये होता है जब smooth muscles relax होते हैं तो vessels dilate हो जाती हैं और blood flow increase हो जाता है. So this then leads to improved circulation to the penis. There is a lot of evidence from homeopaths and other people that turmeric and its active ingredient, जो turmeric का active ingredient है उसको हम curcuma longa कहते हैं. So curcuma longa is an ingredient that can increase erectile function. There is also evidence that essential oils can help manage erectile dysfunction. तो इसमें 8 essential oils लोग recommend करते हैं. इसमें rose oil has shown to relieve depression and to aid in relaxation in animals and human studies. Other oils like lavender oil, rosemary oil, cinnamon oil, basil, ginger, nutmeg and clove oil all works at a few levels, which can improve. There's another oil, I don't know how best to pronounce it, but it is known as ylang oil, which if you have able to access this will definitely help your sexual functioning. So अक्सर मुझसे ये सवाल पूछा जाता है कि vitamins जो हैं, are they good for erectile dysfunction or whether they should take vitamins? I think you should see this with a bit of a pinch of a salt in terms of improving erectile functioning. However, there is a lot of evidence that vitamin B3, vitamin B9 and folate and vitamin D, जिसको हम aspartic acid भी कहते हैं, can actually increase आपका जो हार्मोन है testosterone levels को improve करते हैं, and they are very important for male sexual health and may help improve erectile dysfunctioning. Ginseng and L-arginine may also prove effective. I think some people swear about ginseng that they have had miraculous improvement in their sexual functioning. There are certain creams that are available known as Vitarious cream, जिसका एक active ingredient में prostaglandins हैं, which is a hormone that can be applied to the head of the penis 5 to 30 minutes before sexual activity. So this can increase the actual blood flow to the penis, which then helps to increase level of the erection that people are able to achieve. So in conclusion, the take-home message is that there are definitely psychological causes of erectile dysfunction, and there is often a complex interplay between physical health problems and psychological problems, including factors like anxiety, depression, relationship issues, and stress. So addressing erectile dysfunction requires a rather holistic approach, यानी कि आपको उसको हर एंगल से देखना पड़ेगा, and you have to combine psychological support, open communication, and self-care practices to promote overall mental and sexual health. So remember that erectile dysfunction does not have to be a signal that this is the end of your sexual life, and your partner and yourself can still enjoy physical intimacy in a satisfying sexual life for quite a long time. I think the important message is really not to focus on sexual functioning, but focus on giving and receiving pleasure. Thank you, viewers, for your patience to may have watched this relatively long video. I would encourage you that if you've liked the video, to share it with others, as it enhances the richness of our portal and allows this message to spread so people can benefit or at least see things in a different perspective. I'm very grateful for your attention. I shall see you soon in the next video. Thank you.